Next up, we have Dr. Tracy Kirkham, who is an assistant professor at the Dalla School of Public Health at the University of Toronto and a senior scientist and associate director of the Occupational Cancer Center at the Ontario Health. She has an MS in Occupational and Environmental Hygiene and a PhD from the School of Population and Public Health at the University of British Columbia, where she investigated cardiovascular risk factors among career firefighters. Since her PhD, she has been involved in 5 firefighting exposure and epidemiology studies. She was also a working group member of the exposure assessment of the IARC monograph, volume 132, and organizer for the recent Firefighter Cancer Research Priorities Workshop held in Ottawa, Canada. Please welcome Dr. Tracy Kirkham.
Thank you. I'll do a little bit of a different angle than the other 2 presenters. Recently, so last year, we held a workshop, as Natasha mentioned, in Ottawa, where we talked about, it was as a workshop to discuss priorities for cancer research and firefighters for Canada. So I thought what I would do is present the findings from that workshop. So this workshop was really driven by a couple of factors. One was in 2021, the Canadian government enacted the Firefighter Action Plan. And this plan was to try to reduce firefighters' exposures to flame retardants through restrictions through commercial products. Then in 2022, in January, there was a bill put forward to the Canadian government to reduce firefighters' exposures and reduce firefighters' risk to cancer. And that has now become an act. And of course, I wrote it down on a piece of paper that I left at my desk, but I think the formal name of it is the Framework for Reducing or Preventing Cancers Linked to Firefighting Act. And then and then also the release of the IARC monograph, which showed an increase from a 2B to a class 1 carcinogen status for working as a firefighter. So these were kind of the drivers for this workshop. So this workshop was small, relatively small, around 70 participants. So to have a good workshop where you have a lot of collaboration, you need to have it at a fairly small size. So this 66% of the people were in person, and the remaining were in a virtual, so it was a hybrid model. 17% of these people were international guests. So this was about Canada, so the focus was really on Canadian researchers and stakeholders, but we wanted to bring in some international perspectives to help Canada think about what we can do, so learn from their challenges and wins. And 15% of the workshop attendees were actually members of the working group from the last IARC monograph. And although this was focused on research for Canada, so we had a lot of researchers, it was very important also to include a lot of the stakeholders. So 35% of the attendees were firefighter representatives. And this included representatives from both the union and the management side of firefighting, and included representatives from the military, municipal firefighters, volunteer firefighters, wildland firefighters, and I can't read because I don't have my glasses. I can't read the last one. But anyway, a wide range of firefighter representation. So from this, it was a 2-day workshop. The first day was a lot of lectures, giving feedback and international perspectives, and the second day was all breakout sessions to have discussions about priorities. And through this, we came up with over 500 different gaps that were identified through this workshop. And what we did is we went through all the notes and we kind of combined them into 10 different themes. So I'll go over each of these themes, and they fall into 4 larger categories. So the first theme and major category was underrepresented populations. This was the largest discussed point during the workshop overall. Now, and I'm probably going to say this 10 times, most of the literature is on white male career firefighters. And it's not that we don't think you're important, but there are a lot of other groups that we have no information on. And so it's really unsure if what we know about firefighting is based on the white male firefighter in the career service. How does that impact the risks of others? Like, is it generalizable to the other groups? So some of the big groups that were mentioned were like non-white, so other ethnicities, and also female firefighters, for example. But not just on physical characteristics, but also on different types of firefighting. So we know about career firefighters, but what about volunteer firefighters? Their situation is different. Their access and resources might be different. Also, wildland firefighters was probably the second largest thing that was discussed at our workshop. At least in Canada, we have a very large wildland firefighter population. It's a big issue in Canada, especially in the last couple of years. We've had a lot of devastating fires. So understanding their exposures and risk is a bit more challenging, especially due to the seasonality and the transient nature of these workers. And the other thing is the non-suppression jobs. So a lot of these things are looking at exposures during suppression, but what about the other jobs in firefighting, such as fire investigators or fire prevention officers? There's a lot of other jobs out there. Even wildland firefighting is looking at, you know, the pilots, the truck drivers, the other jobs, even the cooks that work out at the camps. There's a lot of different aspects to firefighting. So the next broad group is looking at health research studies. And this is broken into 4 different themes, probably the more traditional things that we think about. So the first one is epidemiological studies. So a lot of the epidemiological studies out there have focused on the white male career firefighter. The reason for this, though, is not that they want to exclude women or non-white groups. It's mostly due to the fact that there's few of those people, at least historically, in the cohorts or in the population of study. And so then they get excluded from analysis because there's just too few of them to include. Now, hopefully with recent changes, with the increasing number of women and non-white ethnicities working in firefighting, we can try to increase the looking at that. So we need to increase the size of these projects in order to have enough numbers to look at those individuals. We also, a lot of the studies in epidemiology focus only on measuring exposure as ever, never a firefighter. Some studies do a little bit better by including duration of exposure, or duration of employment, sorry, not exposure, but very few look at anything regarding exposures. So we need to improve on the exposure assessment part to inform on epidemiology so we can look at dose-response relationships to give more concrete evidence on the risk of cancer on firefighters. Lastly, a lot of the studies do not account for some very important confounders. So personal factors such as lifestyle factors, such as smoking and diet. We know that these are very important, especially with the risks of certain types of cancers. But also another thing that's really unknown is or accounted for is secondary jobs. So a lot of firefighters, at least in Canada, work a secondary job. Because of their shift schedule, they have a lot of free time, so they usually work a lot in trades. And so not accounting for those exposures really muddies the effect of what we're seeing. The next gap is exposure studies. So there are exposure studies out there. However, most of them are really small in the number of exposure samples taken. And they don't cover the breadth of exposures known that firefighters are exposed to. So we need more studies. We need more studies so that we can get exposure measurements by different firefighting characteristics. So it's just different firefighter types, different firefighting services, so like municipal versus wildlands versus aviation, for example. Because these different types of firefighting have different compositions of smoke and may have different exposures. So we look at aviation firefighters, for example, their exposures to foams might be a lot higher. We also don't know how exposures differ by gender. Women work differently than men, and how they approach work may change their exposures. Also with regards to the issue of how PPE may fit women. We also have a lack of information about, well, people thought that we have a lack of information about how the exposures in the air get through and all the way into the internal dose and what influences those things. So we need more information about that, especially a lack of having rapid testing methods for biomonitoring was really something that was raised. Next, we have the mechanistic and toxicological studies. So a lot of the studies have focused only on 5 of the 10 key characteristics of carcinogenicity. So we need more studies on the other 5 that weren't tested, as well as chronic inflammation, which is one of the studies, one of the characteristics that was studied, but there was still lacking a lot of information. And as I mentioned before, most of this is also, as not surprising, on white males. So we need to know how this differs for other groups. The other thing that was mentioned was about timing of sample, especially for biomarkers of exposure, biomarkers of effect is very important. And especially a lot of consideration needs to go into this when we're thinking of wildlands firefighting, because access and duration of exposure are much more complex. Then we have intervention studies. So there's surprisingly few intervention studies looking at the effectiveness of controls that are existing already. So we need more studies of that. We also need studies to come up with new creative, innovative ways to control for exposures, especially in some situations like wildlands firefighting, where traditional municipal firefighting gear just isn't applicable or possible for these individuals. We also need more information about personal protective equipment for females or males of different builds, and also for certain exposures. So a lot of the exposures are focusing on fire-related exposures, but we know that there's non-fire carcinogens that firefighters are exposed to. And we recently released a study looking at the risk of cancer among paramedics. It's the first cancer that we know of that's ever been published. And interestingly, in the same cohort of people, we saw that the risk of certain cancers were the same among paramedics as they were among firefighters. So this is suggesting that it may be non-fire related hazards that are causing this increased risk of cancer. And one of these was, some of these were looking at prostate cancer and I think it was skin cancer. So things like UV light and shift work are something that we need to also consider. The next 2 categories are based around behavior and communication. This was surprisingly a large topic, and that is, understanding behaviors is needed in order to know about effectiveness of controls. We see that the firefighter culture has changed over time, and it is improving, but we still don't know what are the barriers and facilitators to people following controls, so adhering to controls. Not only on the firefighters, but what about the services? What is it that's making their decisions on whether or what to implement as controls? Because it's not just on the firefighters here, it's also on the services. What are the different methods that we can use to change the firefighters' culture? What kind of training methods are needed in order to get through the awareness and the training to make them adhere to these controls? And then this leads to knowledge translation. So it's extremely important. It doesn't matter how good our research is. If we don't translate it well to the firefighter community, it's useless. So in order to do this, it was clearly written in our report and during the presentations that it requires buy-in from the firefighter services and unions, not just the services, and that they need to be involved in the project from inception all the way through to conclusion. And this includes, when we put forth these recommendations to work with the fire departments and unions to see what is actually feasible. Because we can put forward great results, but if the firefighter departments don't give back to us and say, this is great, but this is not actually feasible, then we can't do anything to help you. But if we have this back and forth conversation, then we can work on how do we come up with adaptations to these controls so it will work for more companies. And this is also about producing common language summaries and not just scientific research. So the last group is about data management and governance. Now this group we felt didn't fall really under research, because a lot of these things were more the responsibilities of government or the firefighting communities to enact, but we would benefit from these, and there are some aspects to this that we could contribute to. So this really falls under 3 different groups. It's data collection and data resources, governance and governance action, and then health surveillance and screening. So the big thing here is there's a huge lack of exposure data and data about the employees. And this is not centralized, nor is it harmonized. So having this would really be beneficial for both the fire departments and also for research. And then the other large thing that came out was about harmonization and a national oversight for things like regulation, compensation, guidelines for the fire departments. In Canada, this is done on a municipal level, and it varies widely. So we do have cancer presumption in Canada in most provinces and territories, but the number of cancers that are covered varies widely by province. So they want a more standardized approach to this. And then also health surveillance and screening. So they came out to have 10 different priorities that were the top priorities for cancer research, which I won't, due to time, won't go over, but there were 4 that were identified for Canada in particular where we're well suited to do the research. One of those was looking at studies investigating understudied populations. We do have a growing population of female and non-white males entering our workforce. If we're able to get large enough studies, we have a great health system, which allows us to link to people quite easily. So we are an opportunity to do that. And we do a lot of large linking studies already. Next is studies investigating exposure interventions. So we have researchers and we have a lot of access to fire departments in Canada with good relationships. It will give us an opportunity to step in and do this. We particularly wanted to focus on wildland firefighters and female firefighters with this, in this group. Next was studies measuring exposure and improved exposure assessment for epidemiological research. So as I mentioned, we have a lot of exposure scientists in Canada. We do measurement data and have a lab infrastructure to do this. So it's to increase the number of samples here so we can come up with exposure assessment methodology or more information about characterization to give to epidemiology research. And lastly is the mechanistic studies on firefighters, looking at the other key characteristics of carcinogen, and then also, and I forgot my notes because I'm going to forget, it's the genotoxic effects for looking at passing this on to their children. And I think I'm out of time. So just if you want to review our report, it's written there, probably much more eloquently than I can present it here in 15 minutes. But this is the link to our report. It's a 65-page report, so feel free to access that and contact me if you have any questions. And just wanted to thank our organizers for the workshop. It was co-organized through the Occupational Cancer Research Center and Health Canada. And then, of course, we had a large team of people who helped with note-taking and report writing. And then lastly, of course, want to thank the participants.